everyone, I'm Dr. Garima Sachi. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic sinusitis in English on the demand of few of my non-Hindi patients. So let's talk about what is sinusitis. It is also known as rhinosinusitis. It is the inflammation of the inner mucous membrane of sinus which can lead to pain and heaviness in the sinus region. It involves mainly females. Females are more affected than males, and 12% population are commonly affected from this sinusitis. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last, because in the last I am going to explain you about some of the homeopathic medicines which can be helpful in curing this sinusitis. Friends, now let's talk about the signs and symptoms of this sinusitis. So there is headache, facial pain which may be constant or aching, or it may be dull. It may be localized to one sinus or more sinus, and it gets aggravated on lying down or on forward bending. And pain may start from one side of the face and may progress or forward to the other side too. In acute sinusitis, there may be nasal discharge which may be green in color, or it may contain pus or blood. Infection of eye socket may occur and lead to loss of vision too. There may be headache present along with it, or toothache may be present, and aggravation on tilting head forwards. Infection of facial bones or bones of forehead may occur, leading to osteomyelitis. It can also involve middle ear due to nasal passage blockage, and it presents the symptoms of dizziness, vertigo, sensation of vibration in the head, and post-nasal dripping. Halitosis may occur, that is bad breath, and there may be poor sense of smell because of nasal congestion. Now friends, let's talk about the types of sinusitis. So it is acute if it is less than for a month. If it is more than for a month, it is chronic sinusitis. Now let's talk about the types of sinusitis according to location. So the first one is maxillary sinusitis, which involves maxillary area, and it can cause toothache or headache. Next variety is frontal sinusitis, and frontal region is above the eyes, so it causes forehead pain. And next variety is ethmoidal sinusitis, that is behind the eye area, and which involves upper part of nose, and it causes headache too. Next variety is sphenoidal sinusitis. It is also behind the eye, and it causes pain at the top of the head or above the mastoid process or at the back of the head. Now friends, let's talk about the complications of the sinusitis. Osteitis, periosteitis or osteomyelitis may occur. It may also involve brain through blood vessels or bones. Abscess or meningitis may occur, or it may also extend up to CNS. Now let's talk about the causes of this sinusitis. So any tooth infection may also lead to this sinusitis, or upper respiratory tract infection like rhinovirus, influenza virus, adenovirus, streptococcus, pneumococcus infection may lead to the sinusitis, or any kind of fungal infection. And any kind of immunodeficiency diseases like AIDS. Cigarettes increases the risk factor for this. Polyps in the nose can also cause the sinusitis, and pollution of the air can also lead to the sinusitis. Now let's talk about the diagnosis of the sinusitis. So clinical examination is more than sufficient, and apart from it, we can see for X-ray, CT scan, MRI scan, or nasal endoscopy, sinoscopy can also be helpful in diagnosing this sinusitis. Let's talk about the prevention of this sinusitis. So hand washing, maintaining hygiene, immunization, avoid smoking can prevent from being affected from sinusitis. Now let's talk about the treatment of this sinusitis. So antibiotics, painkillers and steroids, some decongested nasal sprays can also be helpful, and surgery. Now let's talk about its homeopathic cause, some of the homeopathic medicines along with a cured case of sinusitis via homeopathy. So at first I would like to tell you about the homeopathic cause of this sinusitis. So there is a stink conflict that I am unable to bear this smell. It is stinking to me. Likewise, some people are unbearable to me and they are stinking to me. So this is the conflict. Now, friends, I would like to tell you one of the cured case of sinusitis via homeopathy. A patient aged 12 years suffering from this sinusitis. There was pain in the cheek region, in the forehead, and it was too severe pain. Along with that, there was burning. And there was thin, watery coryza discharge from the nose, and it was also burning and stinging. When we take the whole case, we got the symptoms that patient was too much restless, unable to sleep even because of the pain of the sinuses. And we got the mental symptoms as restlessness, so unable to stand at one place, unable to study, excitable individual, anxiety in bed, and never likes to be happy, very hurry, impatient, and has a sudden impulse to kill anyone. The rubric taken was indifference to happiness, and the medicine given was Rs-Io 200, which cured his sinus problem within a period of 15 days only. Now let's talk about some of the homeopathic medicines which can be helpful in curing this sinusitis. So the first medicine is Hipersulf. So there is sinus filled with mucopurulent discharge and the nose is completely stuffed in it. It gets aggravated in cold air and there is painful nose ulcerations seen in the nose. When we talk about the mental symptoms of this Hipersulf, so the patient is very much dissatisfied, discontented with himself and gets violent from pain and disposition to contradict. He is disposed to contradict to everyone. So if these symptoms correspond, Hipersulf can be helpful in curing the sinusitis. Next medicine is Kali iode. So there is lancinating boring type of pain inside the sinus and there is red swollen tip of the nose, there is congestion and dryness inside the nose. So the cough is dry in this and there is burning and throbbing at the region of the sinus. Now let's talk about the mental symptoms of this Kali iode. So the patient is very much sad, anxious about his health, disposed to just and aversion to being touched and having a startling tendency. So if these symptoms correspond, Kali iode will be helpful in curing the sinusitis. That's all about this topic. We'll meet soon with a new topic, new subject. The clinic address of mine and the contact number is given in the description link. And friends, it's my humble request to you all, kindly don't take any medicine without consulting doctor. Stay connected to stay healthy. Thank you.